Hello, everyone. My name is Katrina Velasquez, and welcome to the session on model legislation as a cornerstone of public health advocacy, examples from the STRIPE Advocacy Playbook. I am the founder and managing principal of a firm in Washington, D.C. called Center Road Solutions, and we are a full-service bipartisan government relations and public affairs firm only for nonprofits focused on serving women and families. So some of our clients include the Eating Disorders Coalition, Harvard University Striped, Sandy Hook Promise, just to name a few. So looking forward to talking with you today about how lawyers can be a really important part of public health advocacy. So there are 4 ways that you can be heavily involved within this process. The first is by actually developing policies, working with lawmakers and advocates and researchers to develop targeted policy solutions. The next is drafting legislation, writing model legislation that can be used from a variety of stakeholders at different levels of government, from local, state, and federal. Also, advocating, lobbying, aka, and helping to coordinate campaigns in communities. And then providing expertise during actual negotiation. What happens a lot is a lot of policymakers are not a legal background. And so when they're trying to make funding work, shrink things to fit within their priorities or make them more appealing to other sides of the aisle, this is one area that we can be really helpful in, is making sure that the goal of the actual policy continues to the very end when it's upon passage. So here are some examples of some eating disorder prevention policy I've worked on. The Anna Wesson Act, which we passed back in 2015, which did actually open up the doors to train health professionals on how to screen, briefly intervene, and refer for treatment for eating disorders. As well as more recently, in the National Defense Authorization Act, we were able to include language that required DoD to report adverse health events from dietary supplements for weight loss or muscle building. So Striped is just a great tool, and I want to share with you their advocacy playbook. And this is just a really great place you can go to really learn the step-by-step process on how to advocate. And particularly, if you're interested within either the dietary supplement realm or eating disorders, we have a number of different model pieces of legislation on there that you'll be able to actually go and you can bring it to your state legislature or even your local government. The Promote Eating Disorder Prevention in Schools Act actually would be really good for a local school board on how to implement that into your school. So really just a great tool for you. Really do encourage you to go on there. So let's talk about model legislation in practice. And I'm using our good old friend IRAC, which you all remember from law school, and starting with the issue. So the issue I want to focus on is that dietary pills and muscle building supplement use is dangerous for children. It's also dangerous for adults, but it's very dangerous for children. They are widely available and they're incredibly dangerous. They often contain unlisted chemical ingredients, including stimulants and harmful active ingredients. As well, they're linked to kidney and liver damage. They increase risk of eating disorders, and they can even cause death. And this actually all comes from a lot of peer-reviewed evidence-based studies that were done through Harvard. So this is how we really understood what this issue was. The next element is the rule. So how do we address this? The FDA actually categorizes diet pills and supplements as over-the-counter. This is a legal issue for us because it really limits federal safety and oversight being categorized as that. There are 2 types of FDA categorizations. There's prescription drugs and there's over-the-counter medicines. So whereas prescription drugs go through an entire approval process that's very lengthy, OTC doesn't go through any pre-approval at all. All FDA requires is that they have proper labeling. And what this means then is that you're having all of these substances that are unregulated and are going into adults like us, as well as kids. States, however, do have the power to limit OTC use for children. And we'll talk about an idea we have that's based on our model legislation. So in thinking about this issue, we would ideally love to recategorize how this is in the FDA. However, when you're looking at this, that lobbying arm is very strong, and FDA is very focused on the COVID vaccine, as they should be, for our kiddos. But state laws can actually act as a quicker form of regulation, as they do have that public health protection law from the Constitution. So here's an example of model legislation that actually is working through the Massachusetts government called Out of Kids' Hand Act. And what it does is it has no over-the-counter sale for kiddos under 18. It requires age verification. Retailers must post notice of adverse health events from the supplements. And there's a fine for retailers for violating this. And so Striped, for example, has all kinds of various fact sheets on here that give us the issue. The draft legislation that was based off of model legislation is now available. They have step-by-step on how to do this. And you can see the bills that are related to this that have been introduced in various state governments. But just encouraging you can take this and run with it. You can take other model pieces of legislation and run with it in your state governments or even your local governments. And so encouraging you to be a power for change. I know you can do it. I do it every day, and I'm positive you can. Thank you so much for your time.